So in 2025 and 2026, there is going to be major changes when it comes to Medicare. We've already seen it. A lot of these changes have come out, but they're going to come out slowly as time goes on. So in this video, I want to explain to you the differences between the Medicare Advantage plans and the Medigap, also known as the Medicare Supplement plans. And the way that I'm going to do this is by showing you charts and data that gives you numbers so that you can make a decision on what the best plan is for you. Now, if we take a look on the screen, the first thing that I want to start with, the beginning, when you're turning 65 or when you want to go onto Medicare for the first time. This could be after the age of 65 if you're still working and you're getting benefits from your company or something like that. But when you want to go onto Medicare for the first time, you're going to contact the Social Security office. It can be your local Social Security office. And you're going to sign up to get this red, white, and blue card that's on the screen. Now, this card is Original Medicare. This is going to cover about 80% of your costs. This card is going to cost the average person, meaning the person that's making an average amount of money per year, $185 a month. Now, if you're a higher income earner and you're making $750,000 a year, you're going to pay a lot more than $185. If you're making $4,000 a year and you're on Medicaid, you could pay a lot lower than $185 a month. But for the majority of people, that's what you're going to pay to get 80% of your coverage. Now, I always say to people, 80% of the coverage sounds great, but if you had $1 million bill and you had to pay $200,000, that would not be so great. So here are the categories that I'm going to talk about in this video. And I'm going to compare Medicare Advantage and the Medigap plans. The first one is going to be the premiums. So premiums can be all over the place. But what you want to see is an average of what this will cost and also what you get for these premiums. Just because something's cheaper than the next thing doesn't mean it's better. So after I do premiums, I'm going to talk about the hospital coverage and the costs, doctors and specialists and how much that's going to cost. Let's scroll down here. CAT scans, MRIs, PET scans, how much they cost, networks, all those different things. Then I'm going to talk about skilled nursing. This is extremely important because as people age, skilled nursing becomes a huge factor with their Medicare plan, and people don't see it coming. I get it. I mean, we all think we're going to remain the same age or years are going to go by very slowly, but when you hit 65, all of a sudden 80 comes rather quickly for a lot of people. Then I'm going to talk about ambulance coverage and the costs, and then I'm going to go into the maximum out-of-pocket. Now, this is very important because when I talk about maximum out-of-pocket, I also have to talk about networks and so forth because some people think, well, I have a $2,000 maximum out-of-pocket. Yeah, but the catch might be how many doctors can you go see? You know, how many hospitals will actually accept you? Then, of course, I'm going to go into the drug plans, the dental, vision, and hearing, and a little bit of the over-the-counter cards that Medicare Advantage plans give you, and the gym membership. Those are just a little extras. I'm not going to spend a lot of time on them, but I will discuss them. So let's talk about the first column, which is the premiums. Now, Medicare Advantage plans will definitely, for the most part, have lower premiums. The reason being for this is because you are going to pay deductibles and copays as you go to the doctor or the hospital. Now with Medigap Plan G and Plan N, the premium is going to be much higher than Medicare Advantage plans, but the coverage is going to be much better. And that's just a fact. For me personally, as a broker, probably 95% of my clients are on Plan G and Plan N. And I always tell people this because I want them to know, look, I'm going to explain to you what the best plans are and why. And then I'm going to explain all the other different plans that your neighbor might have talked to you about, or you looked on the internet and it sounded pretty good. So on an average, Plan G, this is an average. It's not for everyone. It will be about $140 a month for somebody who's 65 years old. Now, if you're 75, you might want to tack on, another $40 a month, $180 or something like that. If you live in certain areas like New York City, this Plan G is going to be over $300 a month. So I'm just giving an average throughout the entire country. It's based basically off of how expensive it is where you live, for the most part. Plan N is going to be around $106 a month, and I'm going to explain why. So, what happens when you go to the hospital with these three different plans? Now, I know I just said Medicare Advantage. There's different companies with all of these plans. United Healthcare, Aetna, Cigna, Humana, for both Medicare Advantage and Medigap Plan G and N. Here's the difference. Medicare Advantage plans have all separate companies, but those companies also have separate plans. So you really have to dive into what the benefits are. When it comes to Plan G and Plan N, every single company out there is going to have the same benefits. So if a Plan G, as you can see on the screen, and the Plan N cover 100% of your hospital coverage, it doesn't matter if you go with Aetna or United Healthcare or Cigna or whatever it may be, it's going to cost nothing. Now the difference, some people might say, and I'll just hover over this, the difference between a Plan G from one company to the next is going to be the service that you get, and it's going to be the price. And a lot of times people want to see, well, the cost is low when they're 65, but it really jumps up when I turn 68. Hey, these companies sometimes try to get people in early when they're 65 and then raise the premiums. People don't want to change. There's all sorts of things that go on like that. But the benefits will never change from a Plan G from Aetna to a Plan G from Cigna or to a Plan G from United Healthcare and so on. Same thing with the Plan N. So let's talk about hospital coverage. So Medicare Advantage plans, yes, they have a zero premium, but the hospital stay per day could be $250, $350, it could be $500 a day, it could be $600 a day. When it comes to the and here's another thing about Medicare Advantage. Not only can the hospital stay be as high as $600 or whatever it may be, you might not be able to go to that hospital. You have to check not only with the company, like the company that you have. So let's say you have United Healthcare, Medicare Advantage, such and such. You have to ask the hospital, hey, I have United Healthcare. And they might say, oh, we accept that. But you can't stop there. You have to say, well, it is plan such and such. Do you accept that? Because United Healthcare has a ton of Medicare Advantage plans. They're not all accepted everywhere. The difference between Plan G and Plan N from the Medicare Advantage is if they accept original Medicare, they have to accept every Plan G and every Plan N at that hospital. So when I say the coverage is perfect when it comes to traveling and these type of things, it is way better than the Medicare Advantage plan. I couldn't think of a better word than perfect. But it is the best coverage that you can get in the country, in my opinion. And I'm not on Medicare. Now, Plan G and Plan N will cost you nothing in the hospital. I have over 17 years experience in this, in Medicare. And the one thing I can tell you is I have clients of mine that have had strokes, heart attacks, everything that you could cancer, everything. And I've gotten phone calls from them, from their children, from their siblings, and they said, I can't believe this. I didn't pay anything, or my husband didn't pay anything. He got the best coverage. We were able to go to the hospital we wanted to. So this is a fantastic feature, and I know I've spent a couple minutes on this, but you have to know that that is the difference between these plans. Let's talk about doctor and specialists. When it comes to Medicare Advantage plans, a lot of them you pick a primary care physician, they don't charge you anything. The government pays for it or the plan pays for it. Specialist might be $35 or $45, maybe $50 to go to. So that's something you have to look out for. When it comes to the Plan G and the Plan N, you will have a Part B deductible for the entire year. Now in 2024, it was $240 for the entire year. What that is Part B covers doctors, specialists, and outpatient centers. So you pay that first $240 with Plan G, then you don't pay anything going to the doctor, specialist, MRIs, CAT scans, skilled nursing. You pay nothing. I'll just hover over this in blue. But all the way down, you'll pay nothing after the $240. With Plan N, you will pay that same $240 deductible for the entire year, but you will also have a copay, and that will be up to $20 each time you see the doctor or the specialist. Now, I said up to $20. A lot of times they will charge you nothing for this. They won't bother. It's like they don't want the billing department to get into it. They'll just take the money that they get from Medicare and the plan and leave it at that. This is one of the reasons why Plan N is becoming so popular. But even if they charge you up to $20 after that deductible, that's all you're going to pay. You're not going to get a copay of $100 or whatever it is. Let's move on to CAT scans and MRIs. Same thing. I've seen it, I have 300 up here. I'm putting this on the low end. I've seen it at 250. I've seen it at 400. But Medicare Advantage plans are going to charge you when you go and get a CAT scan or a PET scan or MRI. You will not get charged with the Plan N or Plan G for these items. You're starting to see how Plan G and Plan N pretty much cover everything. It's fantastic. Skilled nursing. I can't tell you how many phone calls I get. Medicare Advantage plans give you 20 days of skilled nursing. Plan G and Plan N give you 100 days of skilled nursing. I have had people that have, especially strokes and things like that nature, where they've been in skilled nursing for 100 days and they have paid zero and they get the best care. They get to go wherever they want. Once again, when you have a Medicare Advantage, you go to get a CAT scan, they have to accept your plan. You go to skilled nursing, you have to look at the networks. Can I go to where I want? And a lot of times they'll say, no, you have to go over here. This is the biggest complaint. So not only do you get 20 days instead of 100, they'll pick the place where they want you to go. When you have a Plan G and Plan N, you go to the best place as long as they accept Medicare and you pay nothing for 100 days. I've had people, they rave about the coverage when it comes to skilled nursing. Ambulance is zero for Plan G and Plan N, around 250 to, it depends on where you live, but 450 for a Medicare Advantage. And then maximum out-of-pocket per year. Now, Medicare Advantage is going to give you all sorts of numbers for different plans. $2,000 for this plan, $5,000 for this plan. It could be $7,500 like I have on the screen. But they say that's the maximum out of pocket, but do they actually accept the plan? People tell me all the time, well, my maximum out of pocket is $2,000. I see it in the comments. Number one, if your maximum out of pocket is $2,000, you are very limited to where you can go. There's just no way you can go wherever you want and your max out of pocket is $2,000. Here's another thing about Medicare Advantage plans. They will fight with their clients about procedures getting done. Now, me personally, I have over 1,000 clients personally. I also have agents that work with me, and they have their own separate clients. And I do not get phone calls that say my doctor didn't accept this, or I needed to get this surgery done and they wouldn't allow me. I wouldn't be able to have that many clients. And by the way, I have staff that works with me and everything. And so we have a nice little thing going that we're able to help a lot of people out. But with the Medicare Advantage plan, if I had 30 clients, if I had, let's say 100 or 300 clients on those plans, I guarantee you my phone will be ringing off the hook. My doctor doesn't accept this anymore. They didn't approve this. I needed to get surgery and they told me, well, go to physical therapy first. I hear all of these things. That's why I do not do Medicare Advantage except for in extreme cases. Let's take a look at the drug plans. Now, there are zero premium drug plans for both Medicare Advantage. It's not if it's attached. Let me go back a little bit. Medicare Advantage, all of these things are combined into one. Now, let me throw up this chart. When you sign up for Medicare A and B through the Social Security office, and all you have to do is pick up the phone and call them or make an appointment or whatever it is. But that's your first thing that you need to do. After you sign up for Medicare and you get that red, white, and blue card, or while you're waiting, you're going to be making a decision. Do I want to go with a Medicare Advantage plan, as you see the blue side on the right? And if you choose that side, that's it. It will come with a drug plan. It will come with dental, vision, and hearing. It will come with an over-the-counter card, most likely, these things. It will come with a gym membership maybe. But it's all through that plan. But like I said, you have to decide, do you want these little extras or do you want the best coverage in the country? If you choose to go to the red side, as I have on the screen, Medigap or Gap Plan or MedSup or Medicare Supplement, these words are interchangeable. They all mean the same thing. You're going to have to get a MedSup, then you're going to attach a drug plan to it, and then you're going to attach a separate vision, dental, and hearing plan. Medicare Advantage, all in one. Medicare Supplement Plan, you attach everything to it. Might sound complicated, but when it comes to getting the best coverage in the country, in my opinion, that's what you're going to want to do. Both of these have zero premium plans. Some of them cost more, and it really depends on the drug that you take, the copays and so forth. You're going to have to look that up. Dental, vision, and hearing, like I said, Medicare Advantage is going to attach that. It's not attached when it comes to Plan G and Plan N. You'll get a separate plan. It can cost you anywhere from $10 to $50 a month or something like that. It just depends. You'll have to take a look at your area, what they have. The next thing is the over-the-counter card and the gym membership. These two things are just something that Medicare Advantage plans try to give you to entice you into the plan. And I feel like it's going to go bad at very, very soon, where they're going to take away these extras and they're going to raise these premiums from zero going up. They've already dropped a lot of people in the country from the plan. They send you a letter and say, hey, we're not offering this plan anymore. If that happens, pick up the phone and call an agent. So let's go over, as you can see, I'm more into the Plan G and the Plan N than the Medicare Advantage plans. Please leave your comments, because some people, I love the comments. Once again, people learn from the comments sometimes more than the video that I do. At least that's what some people in the comments say. Hey, I love the comments. I learned so much. So leave your comment or ask your questions in the comments below. So if you look at Plan G, let's just go over this real quick. The premium plus the deductible and the copays. You're going to pay, on average, 65-year-old, $140 a month. Multiply that by 12 months, you get $1,680. That's what you're going to pay for the year in premiums. So what else do you pay for? Well, when it comes to the hospital, the doctor, the specialist, the ambulance, the MRIs, the skilled nursing, all of those things, the only other thing you're going to pay is $240 in deductible in 2024. 2025, they're going to raise it, most likely. But you take that $1,680, add that small deductible for the entire year, and you're going to spend $1,920 on all of those things: hospital, doctor, MRIs, CAT scans, ambulance, skilled nursing, chemotherapy, whatever it may be. You cannot get a better plan than that. But the Plan N rivals this plan because it has the same benefits and the same coverage, except they charge you a lower premium. So instead of $140 being the average, it'll be $106 on average. Times that by 12, $1,272. Add that $240 deductible, just like you did for the Plan G. You see it's $1,512. Then add up to $20 going to the doctors. So what I did is I said, okay, the average person, let's say, goes to the doctor 6 times a year. That's $120 if the doctor charges the max amount. Add that. Now we have 1,632. One thing about the Plan N is they have a emergency room fee of $50. It's waived if you get admitted. So I put one time people go to the emergency room per year. And then you have your total of 1,682. So this number, let me scroll down here, maximum out of pocket. I tell this to everyone I talk to on the phone. Out of the people I speak with and people that are my clients, it's split 50-50, Plan G and Plan N. Reason being is some people save a lot of money on Plan N. If you're going to the doctors 100 times a year, specialists, and some people do this. They go to the doctor and specialist, 6 times a month. And they might be spending about equal or more than the Plan G. And they don't want to pay the copays, so they like the Plan G. A lot of people will save money on Plan N, and you get a lot of these same benefits: hospital, doctor, skilled nursing, all of these same benefits, and you can save some money. But that's something I discuss over the phone because it's individualized. I don't have a favorite Plan G or N. Now, Plan N does have a possibility of an excess charge. Less than 3% of the doctors in the country charge this. This means they do not accept Medicare's payment. I can't stand this because it's less than 3% of the doctors. I have never had anyone of my clients or people I've heard of say that they got an excess charge. I had one person the last video I did. One. The last two videos got about 400,000 people that watched them. And one person, that's in the last, I don't know how many years, said, I got an excess charge from such and such. And who knows if he was even telling the truth. I don't know. But I personally have never gotten an email from any of my clients, and I haven't heard any agents that I know that said, oh, my client got charged an excess charge. And keep in mind, the excess charge is the Part B excess charge. So people say, well, I don't want to go to the hospital and I have a $100,000 bill because they didn't accept Medicare's payment. Now, when you go to the doctors, especially the specialist or whatever, you would, most of the time, nobody on Plan N asks, do you accept Medicare's payment? They just say, do you accept Medicare? A doctor says yes, and then they go. But I'll get off of that topic. That's another thing that I talk to people over the phone about for their individual. Oh, the reason why I had these states, I'm sorry. These states do not have an excess charge, but that's why I have them up on the screen. But be honest with you, I do not worry about any of my clients getting an excess charge. It is extremely rare. It's never happened to one of my clients. So one of the things is this chart and many other things are on my website. So this, I'm going to scroll. This is actually a book that I wrote. So if I scroll, I'll try to scroll a little bit closer. So the book is on the website, and let me scroll up to the top. It's called Medicare Without Confusion. It is free. You don't put your email or your phone number, nothing. You just go to my website and I'll show you. Medicare-365.com, and I'll put the link in the description box. But you go to my website, it's pretty easy to see. You got these nice looking people on the screen. But you go to resources and you'll see ebook right here. You just click on ebook. It takes you right there, and then you just read it. It talks about, I have a little something about myself, and then I have chapters, and you can just click on the chapters and it'll go right to the chapter. Or you can just read through the whole book. 4 parts of Medicare, just explain. And I have a lot of videos that you can just click on and do it there. So I hope this video wasn't too long, but I wanted to describe, what's going on. Some of the changes in Medicare. Look, premiums are going up. The drug plans are exploding in price. I know they said that there's a $2,000 maximum. I've been reading like crazy, talking to people, and there's an asterisk to that. There's a $2,000 maximum if they cover the drug. If they don't cover your drug, then they're just not going to cover the drug, and that's it. You have to go find out. So some people will think, well, I'll get on the cheapest plan. There's only a $2,000 maximum. Hey, You have to look, if you're on these expensive drugs, what plan actually covers them. But once again, when it comes to choosing, where's the, I have to go to my little chart here. When it comes to choosing a plan, oh, there it is. Go to the Social Security office, get your A and B. You choose Medicare Advantage or your Med Sup. If you choose Medicare Advantage, you're done. You choose Med Sup, you choose a separate prescription drug plan, separate vision, dental, and then you're done. Hope this video helped. Thanks so much for watching. Leave a comment, and I'll see you at the next video.